Hello everyone. We have started the gynecology cases series and this is case number 19. I'm presenting a case on adenomyosis. The subjective data of the patient is 43-year-old female came with complaints of painful and heavy periods for last 2 to 3 years. It is worsening over time. The menstruation history of the patient is bleeds every 24 days, lasting 7 to 9 days with very heavy flow. Onset of pain is 36 hours before bleeding and it lasts until the day 5. The pain is constant, dull, severe, and it affects the daily activities of the lady. The medical history of the patient is 4 normal deliveries. Husband had vasectomy. Patient takes paracetamol and nifenamic acid for pain. The smear history was normal and it was done 18 months ago. Patient takes citalopram for depression. The objective data of the patient is non-smoker and no alcohol use have been seen. Abdominal examination reveals that the abdomen was soft with vague tenderness in the suprapubic area. I would like to add one point about vague tenderness. It is associated with nausea and belching in the patient. Pelvic examination reveals that the cervix appears normal, uterus is approximately 10 week size, soft and bulky. In non-pregnant women, 10 week size means the size of large orange. It was tender on palpitation, no cervical excitation, additional tenderness or masses. On further investigation, the transvaginal ultrasound reveals that the asymmetrical uterine enlargement was found with thickened posterior uterine wall, ill-defined cystic spaces were seen, and an indistinct myometrial endometrial border, and both the ovaries appear normal. This was the ultrasound scan of the uterus. From the above ultrasound scan, the primary diagnosis can be concluded that the possible uterine pathology, considering the thickened posterior uterine wall and cystic spaces. Now let's dive into further information about this condition. Dysmenorrhea. Dysmenorrhea refers to the medical term for painful menstruation or menstrual cramps. Dysmenorrhea can be of two types, primary or secondary. Primary is a very common type which is seen in every other girl who have periods. The pain lasts from prior to 1 to 2 days, from 2 to 4 days. And in the secondary dysmenorrhea, it is associated with underlying reproductive health issue, which can be endometriosis or fibroids. Endometriosis is a disorder in which tissue that normally grows Endometriosis is a disorder where the tissue grows abnormally. The symptoms of dysmenorrhea can be cramping pain in lower abdomen or pelvis. The pain can be dull or throbbing, which can radiate to lower back and thighs. Symptoms can involve nausea, vomiting, fatigue, diarrhea may also occur. The management and treatment of dysmenorrhea consist of pain medications. NSAIDs are given to the patient. Sometimes heat therapy is also helpful. And in some cases, regular physical activity can also reduces the menstrual cramps. Menorrhagia. Menorrhagia is a medical term used to describe abnormally heavy or prolonged menstrual bleeding. The signs and symptoms of menorrhagia consist of excessive bleeding, prolonged menstruation, which can last more than 7 days, anemia, weakness, fatigue, shortness of breath due to the loss of blood, disruption of daily activities due to the severity of bleeding. Causes of menorrhagia: hormonal imbalance, uterine fibroids, adenomyosis, endometrial polyps, intrauterine devices, and blood clotting disorders. I want to add one point. Blood clotting disorder in women, von Willebrand disease. Von Willebrand disease is a very common blood clotting disorder in women, which can lead to the menorrhagia. Management and treatment of menorrhagia consist of medications. NSAIDs are given to reduce pain. Procedures: endometrial ablation, uterine artery immobilization, and hysterectomy are three surgical procedures which helps the patient. Sometimes iron supplements are also given to the patient to address anemia. Adenomyosis. Adenomyosis is a medical condition where the tissue that normally lines the uterus grows into the muscular wall of uterus, myometrium. This condition can cause the uterus to become enlarged, swollen, and tender. The main key features of adenomyosis is painful menstruation, heavy menstrual bleeding, enlarged uterus, pelvic discomfort, and it can be worsened with age. Diagnosis. Diagnosis can be done through ultrasound or MRI, magnetic resonance imaging. This is the picturation of adenomyosis, where you can see the normal uterus have well-defined endometrium and myometrium wall. The patient with adenomyosis have endometrial tissue spread through the myometrium. The cause of adenomyosis is unknown, but in some cases it has seen by hormonal imbalance or genetically. The treatment options for adenomyosis are pain medications are given to the patient, hormonal treatments are given for birth control methods, uterine artery immobilization, and hysterectomy, the surgical removal of uterus. The patient has been diagnosed with adenomyosis. As our patient was diagnosed with adenomyosis, so in further investigation, we can consider the MRI or additional imaging for better visualization. In the management, initially, we can start with analgesic, the pain management, whereas the corditramol is a combination of PCM and codeine. For bleeding, tranexamic acid is given to the patient. And levonorgestrel releasing intrauterine device is also an option, where levonorgestrel is a synthetic progesterone hormone. And the better option and last is hysterectomy, which resolves the disease of this patient. As our patient was already suffering from depression, so advised psychological support. I'm concluding this case here. Thank you for watching. Share this video and like our content. Thank you.